Good morning or good afternoon, depending on where you are joining us from. My name is Melissa Faulkner, the VP of Marketing. We are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center for Healthcare Innovation. Now in its sixth year, our award program is dedicated to identifying the most transformative, disruptive, and innovative companies that are shaping the future of healthcare. This year, out of 1,500 applicants, 300 were named as quarterfinalists, and we've narrowed it down to 150 exceptional finalist companies. Today, we are proud to present our 5 best in class and 8 Rising Star finalists in our mental and behavioral health category, leaders and companies who are truly revolutionizing this space in healthcare. As a reminder, this session will be very fast-paced as we have 13 companies to present. This is only a small taste of what these companies have already shared as part of their application. If the audience has any questions, please feel free to drop them in the Q&A and we will try to get through them. Our executive producer for this session is Chrissy Farr. She is unfortunately stuck on another call at the moment, but will be joining us a little bit later into the session. But our category champion who is here to start us off is Salome, who is also the founder and CEO of Behavioral Health Tech. Salome, take it away.
Thank you so much, Melissa. And I just want to say a big congratulations to our best in class and rising stars in the mental and behavioral health category. As many of you know, this is such an important time to be working on mental health and behavioral health issues broadly. And I cannot wait for our audience to hear about these amazing innovators. So I will be asking some questions to each of them momentarily, but we'd like to hear a little bit more from some additional partners.
Awesome. At this point, I'd like to introduce Antara from Avia, who will be setting the stage in terms of where we are in the mental and behavioral health space.
Thank you so much, everyone. Good morning, everyone. Again, my name is Antara Sarkar from Avia Health Innovation. Excited to be with you all today. Just for context, Avia Health, we're a services organization and we operate under a network membership model with about 50 plus health systems that we serve through digital health strategy consulting services. Excited to be with you all today here as we dive into mental and behavioral health. This is an area that's super dear to me. A lot of the work that comes across my desk is actually helping health systems grapple with challenges they're having as it relates to quality, access, and coordination of behavioral and mental health care. So just to set the stage here, you can go to the next slide. As many of you may know, we've been in the middle of a behavioral health crisis for both our adult and youth populations. Just to name a few stats to demonstrate the gravity of the issue, research suggests that medical costs are about 2 to 3 times higher for patients with chronic conditions if they have an existing comorbid behavioral health condition. About 1 in 3 adults are reporting symptoms of anxiety or depression in June of 2022 compared to much lower in June 2019. There's been about a 25 to 30% increase in mental health related visits in the ED for children ages 5 to 17. There's been about a 50% increase in adolescent psychology patients since March of 2020. And about 60% of the US population lives in counties with an insufficient supply of psychiatrists. That number continues to dwindle as you consider the psychiatrists who are accepting any form of insurance. And then the funnel narrows even more when you consider psychiatrists who are actively accepting new patients. So it's pretty clear that the supply of behavioral healthcare cannot meet the demand that we're seeing. And so technology is a really great way to close this gap. And if you wouldn't mind moving to the next slide, to help close this gap, we've seen digital solutions span across a number of behavioral health areas to help provide more access to behavioral healthcare services. And at Avia, we think through the space as some of these high impact digital behavioral health areas being on the slide here, screening and measurement. This is really table stakes. The ability to administer evidence-based assessments like the GAD-7, PHQ-9, and the like electronically across all entry points of a system. ED-based interventions. This is a really burning issue as we see more and more behavioral health conditions being caught in the ED. These tools really allow for screening for patients for behavioral health status upon admission, facilitating that evidence-based treatment for all acuity levels, and then also referring patients to appropriate resources for follow-up. We also see self-guide and on-demand tools. This is kind of what you see out there that's provided via mobile apps, peer and group care. There's also telemental and telemat services, which is medication-assisted treatment services, just a way for tools to deliver virtual therapy or psychiatry to patients. And then we also have a lot of solutions that are focused on pediatrics. This population is certainly unique, has unique considerations with the involvement of the parent and guardian. And so this space has particularly been booming in recent years. So just wanted to touch upon how we kind of segment the space of digital solutions in this space. Again, congrats to all the folks on the line that are committed to improving behavioral healthcare and chipping away at a very complex issue. I'm looking forward to hearing the discussion today. And I do want to add, as it relates to Avia, that's on the next slide, and the work that we do and how we can help in addition to the consulting services that we provide. A few years ago, we launched Avia Marketplace to help health system buyers across the country select digital health technology. And now about over 70% of those hospitals and health systems trust Avia Marketplace for their technology selection. So this year we launched buyer intelligence for solution companies like yourselves on the line to find active buyers. And so on the next slide, as a token of our appreciation to all the efforts the companies on the line have put into this competition, we've provided free access to buyer intelligence. You should have received an email from Melissa from Avia regarding the free access. Please reply to that email or feel free to reach out to myself or Melissa should you have any questions. But I just wanted to mention that. Again, thank you, everyone. I'm looking forward to the discussion, and I'll pass it over to Chrissy or Salome.
Amazing. Thanks so much, Antara. Super efficient, which is what we're going to maintain as we go into showcasing our amazing entrepreneurs here. Okay, so we're starting first with Timea. Again, these are really fast, so 60 seconds per response. But starting with Timea, the first question is if you can introduce yourself, offer a quick one-sentence elevator pitch, and how your work is differentiated and uniquely making an impact in behavioral health. Please.
I'm Amelia. I'm the CEO and co-founder of Themia. Themia is revolutionizing mental health assessments by leveraging cutting-edge neuroscience and ethical AI. Unlike traditional methods that focus on subjective questionnaires such as the PHQ and the GAD, Themia is actually the first company to create objective mental health biomarkers by looking at speech patterns, upper body movements, and behavioral data, which we gather via specially designed video games. Our groundbreaking technology combines multiple modalities and allows us to assess major depression, generalized anxiety, precisely and reliably, not just measuring the condition, but also symptoms, including fatigue, mood, burnout, and even poor appetite. Our ethical AI models are by default language and culture agnostic, powered by the world's largest proprietary dataset of its kind. What sets us apart is not just our unique multimodal approach, but also our completely user-focused design, which uses gamification to enable better engagement of patients and better adherence over time. By offering more objective handles, we are creating essentially the equivalent of a blood pressure cuff for mental health, enabling better, faster, and more accessible clinical decision-making. Hopefully that was within your 60 seconds.
Excellent. And Amelia, real quick, tell us more about the populations you impact and what you're looking forward to in the next 12 months of your business.
Yeah, absolutely. So I mentioned just now that Themia's models are actually by default language and culture agnostic, which is amazing. And the beauty of the technology and how we use it is that it can actually be used by anyone, anywhere, provided they have a smart device. This is also one of the reasons we focused on voice and video, because they are so extremely accessible versus, say, wearable devices or headsets and so on. So the idea is here basically enabling anyone, anywhere. The real populations we're actually shining with is those populations that actually cannot express themselves that well through questionnaires, such as non-verbal autistic individuals, older populations, or people who for one reason or another cannot actually express themselves that well. We can actually overcome that stigma and overcome that issue and get to the real core and heart of the problem by showing that actually somebody's mental health is objective, it's tangible, and therefore it's also treatable because it's real. It's not just in their head. In the next 12 months, we're really looking forward to going live with the NHS. We are scaling to over 100,000 unique voices and users in our dataset, which is the largest, well, it already is the largest of its kind, but it actually allows us to actually scale to multiple new disorders and creating the world's first foundational biomarker models for mental health. So that's something we're super excited about for the next 12 months.
Excellent. Thanks so much. All right, next up, we've got 90 seconds OPTT Health. Please come off camera here. I've got my first question for you is to introduce yourself, one sentence elevator pitch on what you do, and how is your work differentiated and uniquely making an impact in behavioral health?
Thanks, Salome. So my name is Dr. Mohsen Omrani. I'm a co-founder and CEO of Opt. Opt is a B2B SaaS digital mental health platform targeted at healthcare organizations to increase their care capacity and lower their cost. We equip clinicians with clinically validated digital mental health content and AI capabilities to facilitate care delivery and evidence-based practices. We use machine learning and AI to make objective evaluation of patients' mental status and provide clinicians with actionable insights about the best next step in their patient's care. What is unique about what we do is how we are integrated in the clinical care. So it's like we believe that if we are designing anything to be used by clinician, it should fit into their current workflow. That is why we are using natural language processing algorithms. And also, whatever we do is, we put them through clinical trials. We have done more than 15 clinical trials. More than 2,000 patients have gone through these clinical trials. And all the content that we develop and all the algorithms we develop are first validated in clinical trials before we put them on the platform.
Excellent. And real quick, 60 seconds, what are you looking forward to in the next 12 months of your business?
So we are starting a partnership with some health systems and one payer. But what is more exciting, we just recently started a partnership with Mayo Clinic platform that gives us access to their EMR data, like 2.7 million patients. And we are the second company to use large language models to extract unstructured data and use that to predict, outcome of the care and be able to suggest the best next care. So we're really excited about that.
Thanks so much. Okay, next up, NeuroFlow.
Hi, everybody. I am Phil Vecchioli. I am Chief Revenue Officer of NeuroFlow, and thank you for having us. Every day at NeuroFlow, we're driven by the notion that you cannot manage what you cannot measure. We bring to bear unique, at-scale, data-driven collection methods and insights across a wide variety of the industry that separates us completely. And specifically what I mean is we have the ability to ingest massive amounts of claim data, EHR data, and other types of data, and provide a continuous feedback loop that spans across population health and measurement-based care in tandem. We look at all sets of hands continuously every day. If you look at the cost of not identifying patients in a lower cost setting before it moves to a higher cost setting, we all talk about gaps in care. We all talk about the need for next best action, but we don't often talk about financial sustainability. And the answer isn't just piling on access. The answer is advanced techniques, leveraging the best and brightest in technology to give providers real tools. If you just look at suicide ideation, we all understand the terrible societal impact. But if you stop and look at the cost of ideation and where it begins, you recognize the need for these advanced collection methods. Many of our clients look at next best clinical action, but also reporting and capabilities to report out to employers, to members, to other clinicians in the quest to leverage everything we know today in technology to paint a picture of a population today that goes underserved and has no real connection to chronic illness the way it should be. Some specific impact points to what we do: we see in client settings up to a 75% reduction in psychiatric admissions and hospitalizations, 63% reduction in ED visits, and one of our latest endeavors in the state of Colorado for Colorado Medicaid, by deploying consistent measurement-based care in conjunction with the primary care component in the market, we saw a 28% reduction in PMPM costs along the total cost of care continuum, which equated to about $25 million in savings to the state of Colorado.
Okay, 20 seconds, real fast. Next 12 months, what do you expect in your business?
Artificial intelligence offers the ability to advance in areas like ecological momentary assessment, scraping unstructured data, natural language processing. That's the future. We are going to be the market leader in showing the financial and clinical impact of advanced real-time data collection.
Awesome, thank you. All right, next up, we've got Equip.
Thanks, Salome. Hi, everyone. I'm Christina Safran, co-founder and CEO of Equip. We provide virtual evidence-based eating disorder treatment to kids, adolescents, and adults all across the country. What differentiates us? Eating disorders are prevalent, deadly, super poorly treated. 30 million Americans will have an eating disorder at some point in their lifetime. 80% don't get treatment, and only a tiny fraction have access to treatment that works. There's a huge shortage of evidence-based clinicians in the country, and in that vacuum of care, residential facilities have emerged as the go-to, despite no evidence that they're effective. And we have good quality evidence-based treatments, but they're totally stuck in a handful of academic centers across the country. So what Equip aims to do is essentially disseminate access to those evidence-based treatments. Everyone who joins us gets a multidisciplinary care team. We partner with payers to cover a year of treatment and really treat them from their eating disorders and also the comorbidities that impact them, really producing high quality and sustainable recovery. Really proud that today we have over 100 million Americans who have access to Equip through their in-network benefits, including about 5 million Medicaid members across the country. We've also expanded our services to adults in the last year. And I guess I'll just kind of go over in my time to the next question to share what I'm most excited about in the future, which is really continuing to expand access to those covered lives so that every single person has access to care that works. Specifically, the Medicaid market is our next big frontier. And I think we're at a really exciting point where we've proven on our first several thousand patients that we can disseminate the best of our existing evidence-based treatments on par with the strongest academic centers in the country. Now we have an opportunity to make those existing treatments better. We now have a larger and more diverse data set of eating disorder patients in the world, and really have the opportunity to make treatments more effective for a much more diverse set of patients and families.
Perfect. Thank you. Next, QB Tech. Please introduce yourself. One sentence.
Hi, I'm Danielle Vaith. Thanks, Salome. Danielle Vaith with QB Tech. We offer an objective FDA-cleared test for ADHD. ADHD affects 15 million Americans and is both over and underdiagnosed. Our technology really brings those patients closer to a more accurate diagnosis and treatment monitoring through measuring attention, impulsivity, and hyperactivity, which are the core symptoms of ADHD, through a computer-based assessment that is backed by over 40 independent peer-reviewed studies. ADHD, if left untreated, can have devastating consequences, yet the current standard of diagnosis has really been the same since the 60s and is ripe for shakeup. It relies heavily on subjective rating scales, which are filled with bias, and although very critical, can be contradictory. And so when we think about upskilling and really looking at addressing provider shortage in the entire ecosystem for patients with ADHD, we know that clinicians are lacking training. Our data, not just our subjective and objective data, but we also provide clinical support training to really help handle some of the provider shortages. We leverage facial recognition technology and are the only solution that really measures hyperactivity, which is a biomarker, and often overlaps with other conditions. And it's typically the first to respond to treatment. We produce a comparative report that's highly visual, that is easy to read by both the clinician and the patients, and can be addressing both complex cases as well as treatment response. When we look at those reports, and adding in our technology, we're reducing wait times by over 30%. We show an increase of clinician and patient confidence between 88 and 93%. And we know that that then can lead to less seeking of second opinions, for instance. And we're also able to monitor treatment. Our objective data serves as a safeguard for prescribing, which is especially crucial given the scrutiny around Schedule II medications commonly used in ADHD treatment. I will just roll right in. The populations that we're treating, ADHD is something that I love advocating for, and it's not just something that's in kids. There's a 400% increase in adults with ADHD concerns, yet the existing provider shortage is even smaller for those who are willing to address this condition. One clinician supervisor shared with me the anxiety around treating ADHD in adults is palpable, which is why they actually address and adopt our technology. We're able to improve and leverage data through a standardization of care, which is vital in improving outcomes and really setting a new standard. Our current technology is utilized by thousands of clinicians across 46 states in the US, and it's also internationally in 12 countries. From a scale perspective, we are doing work in the UK with the National Health Service, where we are used in 80% of clinics assessing ADHD. And really what we're looking forward to in the next 12 months is to leveraging what we know, right? So we've just tested our 1 millionth patient. And although this took some time, we expect to get to another 500,000 by the end of 2025. And over the next 12 months, we're really focused on using and advancing our technology, our evidence base, and our outcomes for success to do so at scale. This year in the US, we're expanding our partnerships with health systems, virtual care delivery models, and payer in a school, hopefully, to mirror and broaden what we've already demonstrated in the NHS and those improved outcomes.
Good morning, everyone. I'm Sean Bell. I'm the general manager here for New Ventures at Spring. Spring Health was born out of its founder's focus on eliminating all barriers to mental health. Our platform now supports over 12 million employees and dependents, where our algorithmic precision allows us to precisely match patients with over 10,000 mental health care providers with a wide range of backgrounds and clinical expertise. Nearly 48% of our provider population is BIPOC, which allows us to get both cultural fit as well as lived experience and clinical expertise. That allows us to get patients into care in under 2 days with a 96% first provider match for therapeutic alliance and a widely published third-party validation of 2-to-1 cost savings for payers on an 80% improvement in patient mental health. Recently, we launched the third leg of our technology platform, Atlas, which is a first-of-its-kind reporting platform designed to empower HR teams and benefits leaders to optimize behavioral health initiatives and ensuring maximum impact by combining health data, clinical data, organizational data, and social determinants of health data into insights that allow us to look at the mental health of the employee population in regards to the organizational health of that company at the same time. We're addressing the pressing need for data-driven insights for these time-crunched leaders. Atlas allows these organizations to leverage comprehensive data to enhance their mental health support for their workforce by bringing together these multiple data types and finding trends and insights that allows them to target initiatives and efforts that improve business outcomes while aligning mental health care needs of their employees into single initiatives. We work with approximately 60% of the United States receives their health care or their mental health care specifically from their from their employer. And we work with all ages, from small children all the way up to those who have retired and gone and left the company but still remain as part of their program. We work with multiple segments in the employer population, including very large customers, all the way from Microsoft, Boeing, Verizon, et cetera, all the way down to very small customers who are working through their payers. What we're most excited about is the ongoing work to bring in data and experiences, mental health care experiences for disparate populations. So we've launched a first-of-its-kind community care integration where we're pulling in social determinants of health data as part of the mental health care journey of each of our members. And we are launching a new offering in specialty healthcare where we're expanding our focus on the needs of acute and more complex behavioral health needs on platform, with a single focus on under 2-day care with specialized providers to get to the outcomes for folks who are often struggling with more complex needs. So happy to finish up there, but thank you all.
Awesome. Osmind. 90
Thank
seconds.
you. Awesome. Thanks. Hi, everyone. I'm Lucia. I'm co-founder and CEO at Osmind. We provide software and data for breakthrough mental health research and treatment. So I co-founded Osmind because I really believe there's a widening gap between innovation and clinical care, especially for patients with moderate to severe mental illness. On the innovation front, there's actually a lot to be excited about. There have been developments in neuroscience and new sorts of treatments like psychedelic medicine and neuromodulation. But unfortunately, these treatments take on average 15 years to actually get into clinical practice. And there's this widening gap between what's actually happening on the innovation front and what's happening in clinical care. So we really believe that that stems from a lack of good data and technology to deliver precision psychiatry. And so at Osmind, we're building a learning healthcare system to close that gap. So what we offer is we have a network of nearly 1,000 independent practices on our psychiatry-specific EMR. And we try to streamline clinical practice and gather data to push forward research with our clinics and life sciences and other sorts of researchers and really apply that back to the point of care. So our research has really mattered so far. We've collected one of the deepest data sets in serious mental illness with over 3 million outcomes on hundreds of thousands of patients. We've published multiple peer-reviewed papers, lots of fun topics such as comparing real-world esketamine versus ketamine outcomes, and lots of other data that really matters in how we better understand mental health care.
Hi, Nick Mercadante. I'm founder and CEO of Pursue Care. I'll try to be brief for everybody. So I've spent most of my adult life focused on pharmacy and mental health, specifically trying to solve for issues with care delivery, health equity, lack of continuity for our most at-risk populations that we usually leave behind. Pursue Care at its core is a health equity virtual care provider. And we focus on treating people living with substance use disorder, especially in rural areas, remote and underserved communities, people that face a lot of barriers to care. And we really, really focus on treating addiction as more of a chronic, multi-dimensional condition. It's not something simple, and it's not something that goes away. We have to live as a service long-term with the patient. So how we differentiate is we offer a very comprehensive spectrum of services in our treatment plans, and we deliver that virtually through a smartphone app that we've designed for care. Our treatment includes medical care, both for opioids and other drugs, physical health care for sexually transmitted and other comorbid infections, behavioral therapy, psychiatric care for the roughly 60% of patients who benefit from that. And we also uniquely have our own in-house pharmacy for patients that struggle with going to a local pharmacy and getting the help that they need. Uniquely, we also offer the only FDA-approved digital therapeutics for treatment of substance use disorder and opioids. Those are Reset and Reset-O. What those help us to do is engage with patients 24/7 and deliver cognitive behavioral therapy digitally alongside our treatment, and also rewards for lasting recovery. And all of this wrapped together, what it does is it helps to penetrate and reach rural and remote populations in West Virginia and Kentucky, where we started, Maine, New Hampshire, Pennsylvania, and Ohio. And it also leads to 30% higher abstinence rates, improved retention in care long-term, and 50% reduction in hospitalizations, which is a cost savings measure.
Hi, everybody. This is Prashant Manan, the CTO of Backpack Healthcare, where I lead the development of our AI-driven technology platform that enhances pediatric and family mental health care by providing patient engagement, clinician efficiency, and care coordination through several personalized data-driven interventions, and thereby improving outcomes for children and families and clinicians. How our work is differentiated is essentially through our AI platform. It's specifically designed to address gaps in pediatric and family mental health care and geared towards patients and clinicians both. So we improve the clinician experience and reduce administrative burden as well. So we integrate predictive analytics, which help clinicians identify at-risk patients early. Our platform also features an AI care companion, which offers ongoing support between clinical visits and keeping kids and teens engaged in the treatment. But it's also used for patients who are not seeing a therapist to understand their condition and get care. We focus on AI-based personalized care pathways that adapt to each patient's need with every piece of information that's provided, leveraging data insights to tailor interventions. We also have several solutions for clinicians to help reduce the administrative burden, like I said, and improve the quality of care, like AI-based personalized treatment plans, automated progress notes, and clinician expert assistant. With all of these, we're seeing at least 70 to 77% reduction in GAT-7 and PHQ-9 scores, and also an 83% net positive and NPS, which is versus industry average of 34%. So we're about 83 versus a 34% industry average. And in the next 12 months of business, we're excited about a lot of things that are coming in. We're expanding our partnership with major healthcare systems and schools, which will allow us to reach more children and families in need, particularly in underserved areas. We're also advancing our AI and predictive analytics capabilities and expanding our care pathways to include AR, VR, and other technologies to further improve patient experience and outcomes. And lastly, we are deepening our integration efforts with large payers and hospitals and leveraging our technology to help them enhance their mental health programs. So these are all things that we're excited about.
Awesome. Thank you. Nirogli?
Thanks, Salome. This is Mike Lubin, Senior Vice President of Nirogli Health. We are a company focused on the cognitive impairment and dementia care space. focused on patients that kind of span that range, from early cognitive impairment all the way through kind of advanced dementia. What makes our solution unique is a number of things. First of all, most dementia care starts after a patient has been diagnosed with dementia, and in many cases, that diagnosis happens after a costly health event. We've developed the first solution with a clinical study behind it that has demonstrated significant outcomes for patients with mild cognitive impairment or early kind of pre-dementia cognitive impairment issues. So we're able to engage patients and their care partners at the entry point, the beginning of cognitive decline, with a solution that improves outcomes for both patients, builds skills, resilience, habits for both the patient and the care partner, so we can start to totally change the trajectory of this disease experience, and the cost impact that this disease has on patients and care partners by starting with patients and building long-lasting partnerships at the entry point. What we're focused on for the next 12 months is expanding partnerships. We are focused on partnering with risk-bearing entities, health plans, and health systems. We have 2 health system clients right now that we've further demonstrated the evidence in our solution, and we're looking forward to expanding those partnerships in the next 12 months.
Excellent. Good timing. Neurogly. Let's see here. Overcome, rather.
Thanks, Salome. Hi, everyone. My name's Adam Hutchinson. I'm the founder of Overcome. There are 301 million people around the world that have a mental health condition that needs exposure therapy as part of their intervention. But unfortunately, 80% of them receive no treatment whatsoever. And this is due to cost of current treatment, location for many people are in a rural area. There's a stigma, particularly for men. And there's also massive waiting lists around the world to access this treatment. What Overcome does is deliver virtual reality exposure therapy via a direct-to-consumer channel via their smartphone. It's safe, data-driven, we're now clinically effective, and best of all, it's incredibly scalable, and that's our real focus with Overcome, is scale, getting this technology and treatment into the hands of the people that absolutely need it. We know that the people that do need this treatment, they can't access it, and that's what we're really going after to solve, is around the accessibility of this treatment. What differentiates us is our knowledge of the problem. I was personally diagnosed with social anxiety disorder when I was a teenager. I've been through the treatment. I know the problem well, and with my background in technology, I'm able to solve this problem in a really unique way. We are clinically proven, which is, we've been through a clinical trial with the University of Otago where we showed on average there was a 75% reduction in the severity of someone's phobia after 6 weeks of treatment. For the next 12 months, we're really excited about launching our new partnership with the NHS in the UK, helping children and adults with autism to experience hospital environments. Later this month, we are launching our new B2B channel, which is a clinician portal for clinicians to be able to get access to our huge library of VR content. We are learning from those decisions that are getting made so we can personalize treatment for our direct-to-consumer users that cannot afford to see a clinician. So they're getting really good decisions made for their treatment pathway. So super excited, and thank you for the opportunity.
Wonderful. Thanks, Adam. ViewMind.
Hi, my name is Mark Edwards. I'm CEO, co-founder of ViewMind. ViewMind has developed the world's most advanced technology for analyzing brain health functionally with unparalleled sensitivity, and shows promise to measure results that correlate also with structural brain health changes. We have 24 patents, 80 publications, and it's all built on a foundation of 23 years of R&D led by our Chief Science Officer. The solution is a software as a medical device. It uses visual stimuli presented in a VR headset, eye tracking technology, and machine learning to assess brain function. The output is a detailed report providing critical insight in terms of brain health by cognitive domain. The eye is part of the brain and offers a direct pathway to vital brain information. Compared to other technologies, ViewMind stands out for its precision and sensitivity, and it is able to even detect fine-grained changes in brain function caused by the progression of a disease, a disorder, or an intervention. The assessments are objective, repeatable, and consistent, and able to be applied to brain health and mental health disorders. The technology has been applied to a variety of different mental health disorders, and we show promising results to be able to measure the impact of treatment in people with who are taking medication for unipolar depression or bipolar disorder. We have a very experienced executive team with multiple exits. So, sort of in summary, ViewMind is brain health insight. In terms of the populations that we're impacting, there is a huge need for this type of solution. The market today has a variety of technologies which either lack sensitivity and are just clinical decision support tools, or you're looking at maybe a 2 to 8 hour assessment by a neuropsychologist that is not scalable, as was mentioned by Antara in her introduction presentation. ViewMind addresses these issues. Our technology, it works independent of language or numbers, and it's deployed in around the world in 4 continents. And we're working with a variety of different populations, particularly focused on the 45-year and above at the moment in dementia and also in mental health disorders. In terms of the next 12 months, in terms of our key priorities, the first is we are pursuing a de novo application with the FDA as an adjunctive diagnostic. We think this will be a game changer for healthcare and for drug development. We're also preparing a second indication FDA submission as well, which will show correlation with structural tests, neuroimaging, and biomarkers. Commercial scaling is also a key priority, and we are currently doing pilots, and we're expecting those to start to scale up very soon. And we're also raising a Series A financing. Thank you.
Thanks so much. Seven Starling.
Thank you. Hi, everyone. I'm Tina Kashani. I'm the co-founder and CEO of Seven Starling. I'm also a new mom of a feisty and sweet 5-month-old girl. Seven Starling is a women's behavioral health company, and we focus on offering specialized treatment for women who are going through the motherhood journey. And specifically, we focus on pregnancy, miscarriage and loss, fertility, postpartum, and early parenthood. And what makes us really unique is that we offer specialized care. All of our therapists have perinatal expertise. We offer specialized groups. We have specialized content in our app, as well as medication management. The thing that makes us really unique and differentiated overall, though, is that we partner with OBGYNs to identify women early on in their journey who are struggling with mental health and getting them into care really quickly. And we also have really broad, vast in-network coverage that makes care really accessible and affordable for women across the country. We are focused on the 1 in 5 women who are struggling with their mental health through pregnancy and postpartum, and specifically the 85% of those who are diagnosed who never receive treatment. When we think about the next 12 months, what I'm really excited about is our expansion into Medicaid. We're currently live in 10 states across the country, expanding very quickly, partnering with most commercial plans, and Medicaid is a huge gap that so many women need today when it comes to their own mental health support during this really important time. Thank you.
Great job, everyone. Thank you so much. I think my colleague Chrissy might have a few questions for you, but really excited to hear from everybody.
Hi, everybody. Nice to meet you, Tina. And I'm also the mom of a feisty 20-month-old. So the feistiness just continues. Would love to hear, kind of given, I have a background in women's health and behavioral health, where you're seeing kind of the bulk of the need. Do you tend to see it kind of in the period before, because there's definitely a lot of anxiety associated with birthing and a lot of that, or the period after where you're sleep deprived and you've been given a baby with no support. So when do you see those peak moments of need from a behavioral health perspective for new moms?
I love this question. Thanks for asking. And I can relate to the feistiness continuing over the last few months at least. So today, actually, most of our patients come to us at the postpartum mark, because a lot of the OBGYNs that we partner with are screening their patients at that 6-week postpartum visit. And so the way that our programs work today is that we are sort of that natural resource when an OB identifies a need in their patient during that screener. Now, where we're going is actually creating a screener of our own at Seven Starling that integrates into a lot of these clinics, that allows our clinicians and OB partners to screen their patients way earlier in the motherhood journey, so specifically during pregnancy. And what we're finding with our initial results is that we actually can identify women who are at risk and are starting to see some of those mental health issues come up early in their pregnancy journey and are at risk for more severe symptoms postpartum. And so today, a lot of those issues are identified a bit too late. We can do so much to get ahead of those issues earlier on with better screening tools, like the one that we're launching at 7 Starling.
Great. And that was a specific question for 7 Starling, just given the focus. So, a question that I would love to ask everybody else on the call. I think we all have seen that this category has been tricky for a lot of reasons. It's a very tough one from a regulatory perspective. It's very easy to do something that kind of runs afoul of I think in some cases the FTC and other agencies where we've recently kind of seen a lot of this play out. So what are you all doing to ensure that you are providing that convenience and ease of use that's so important to your patients, while also having really strong kind of clinical independence and making sure your clinical teams feel that they can administer the type of care that they see fit, and then managing the expectations of VCs at the same time? That is a really hard question, but if anybody wants to jump in, I'd love to hear thoughts on this.
This is Phil from Neuroflow. I mean, we look at constantly improving around meeting the member or the patient where they are. So looking at all different types of engagement, ranging from more anonymous, digital front ends, and then weaning patients on more things like wearables or continuous engagement on a daily basis, whether you're in care or not. And that's really helping us find the best and brightest ways to approach a very diverse population. One day we're with the Veterans Administration, the next day we're with one of our disability carriers. While data collection is alive and well in both, getting to know those members requires getting really good and smart at the combination of art and science in engagement. The clinical underbelly stays proficient where it is, but its ability to reach more people increases, and that's where we have a broader impact.
This is Nick from Pursue Care. So so first I'll start with, I'm a healthcare risk attorney by background. So it always helps to have someone in your leadership that grapples with this stuff. But I think we're in a unique position at Pursue Care, being that we're in a highly regulated space of treating substance use disorder. Our patients are heavily stigmatized. There's a lot of bureaucratic stuff that happens at the state level. So even when the federal level is trying to push the ball forward with opening up regulations for things like telehealth and prescribing controlled substances, the state level each state has its own unique set of circumstances. So we focus on two primary things. One is go through the front door and work very closely, locking arms at the state level, make sure that you build trust at the community level. And I think uniquely for our model, we're not just reliant on delivering care virtually. We also partner at the community level with physical health care and in-person care for patients that need it. And then the second thing is allow our provider team to be autonomous and follow their own clinical care standards. So we have a dyad. I don't oversee our medical directors and medical leadership. They oversee themselves, and then we work together on that.
I could go next, if it's okay. I think it's important, to remember when we talk about mental health, it's like any other field of health. It is important that there is validation, and it is like anything that goes out should be validated. We do not expect anything less from any other field in diabetes or surgery. So that's why whatever content we develop, we are committed that it's connected to a clinical trial, connected to a peer-reviewed article. So when we say, for instance, our module reduces symptoms by 40%, there's a paper, you can pick it up yourself. And the other part is that it is important that to know what clinicians actually do before developing something that we think clinicians might use, right? So it's like if clinicians are 90% of their decision is relying on the language use, using something like a temperature, even if it might become very useful, might not be picked up by clinicians. So it's really important to have those clinicians in designing and validating your solutions.
I think I would add to that because it's absolutely right. You have to have the clinician and the patient experience. Being a medical device, we're FDA cleared and ISO, and it takes a tremendous amount of manpower and investment from an organizational perspective to do that right? And have the outcomes data and thinking through, I think one of the things that we can work together on is really thinking about how are we going to measure outcomes, not just from a technology perspective, but from a systems of care perspective. And so that's really where we're trying to focus on is looking at not just the smaller improvements, but the overall population improvements. And I think taking some point solutions and some larger solutions together, we'll be able to do that.
Maybe just to add, I think one of the challenges is that there are many different therapies, interventions to treat mental health disorders, but oftentimes the mental health disorder is not even diagnosed correctly to start with. That's the first problem. And then I think one of the second challenges is that people respond differently to treatment. Everybody, has their own individual physiology. So being able to actually get an objective, precise measure of how somebody's responding to treatment is hugely important. And that's what we're really focused on, trying to provide that objective data.
I think the only other thing that I could add there, I agree with everything that's been said so far, but just making sure that the internal teams are aligned in the goal, which is around, making accessible, clinically safe interventions. And so as long as everyone's on the same page with what we're trying to do, I think, we can all, achieve the same outcome. The clinical team is working with the UX team is working with the dev team, and we're all working towards that same goal.
Do you think AI is overhyped, underhyped, just hyped enough when it comes to, your particular category or company? Keep questions really short or answers really short.
Bill from Neuroflow, I think it's hyped enough, but it definitely requires being very specific about the type of use that you intend.
I think on the Osmind side, there's a lot of upside, but I think there's a lot of potential downside and risk too, especially when we're talking about patient care. The need for quality is really high. So we serve clinicians and life sciences researchers, and we really need to get everything right. You can't have a misdiagnosis. You can't have a chart that's wrong. So I'm optimistic, but also really we want to be thoughtful going into it as well.
In the case of UMind, I would say probably the answer to your question would be all three. In our case, we are really focusing more on machine learning, and it's very important that we can explain and characterize the biological underpinnings of what we're doing to the FDA and to clinicians in general. So that's our approach. There are certain ways we use AI, but it's a little bit different.
Yeah, this is Sean from Spring. I would concur with what Mark said. I think we use the term AI way too loosely. They're all forms of AI, and I think most people are referring to generative AI when they're talking about this, which is one tool out of many that have been out there. Natural language processing, machine learning being lots of great opportunities to work. And as we talked about earlier, the opportunities to use objective, quantifiable data as ways to create measurement-based care regimes makes a big difference. I will always remember, though, and we talk about this all the time, humans as a whole are not accountable to a technology. They are accountable to each other. We're highly, highly hardwired for that level of empathy and engagement, and fake empathy or faux empathy is something that people detect very quickly. And it's a big turnoff in something as important as like severe mental health care needs.
I would add, I agree with everything that's been said. I think a little overhyped, but I think we're also using it in different ways. So I agree. We know that patients self-report. We can actually identify 50% more accurately if someone's responding to treatment than by self-report alone. But that doesn't actually remove how the person is feeling, right? That is just as important, and why they're feeling that way. It gives the clinician the opportunity to look at the objective data and ask and look at what is actually not lining up. So I think there's ways to use both.
One challenge that I think exists in this field is that a certain usage, like ambient, summarization, becomes the, thing that everybody thinks about it when we talk about AI. It is, that becomes overhyped, but there are so many different uses. It's a technology, and it could be used in many different ways, and we are really in the initial days of it.
Yeah, I can jump in for Seven Starling. I think that generally for our category, I think it's probably a little overhyped. And the reason I say that is because I don't think it's going to replace direct patient care, but I see it as a really important enabler for providers and specifically for us, how we think about clinician burnout. So I love AI. I think it's awesome, but I don't think it's going to solve all our issues, but I think it's going to definitely make the environment an easier place for clinicians to work.
This is Mike from Neurogly. I would err on agreeing with some of Lucia's comments. I think you have to be really careful with the breadth of application of AI in the space, given patient sensitivity. I think it's underhyped in terms of the operational efficiency opportunities to be able to scale, processes, and that's a lot of where we're focused to be able to help support access challenges and barriers.
I'd just maybe echo what some others have said or alluded to. At Pursue Care, we kind of view AI, we break it down into constituent parts and look for its utilization, oftentimes in non-patient facing ways where we can create efficiency or greater clinical insight from data. We view AI as kind of a stochastic parrot, meaning it's very good at taking data and delivering an answer it thinks you want or is plausible, but it doesn't understand the meaning of those words, right? And therefore, it's not fit to be part of patient-facing engagement where you might end up inadvertently turning a patient off or even tricking a patient with AI in potentially dangerous ways.
We've got a really interesting use case with Overcome for AI, and it's the development of exposure hierarchies, which ultimately gets the best outcome. We're training that model off our new clinician portal, which basically means that all the people that can't afford to see a clinician and get those decisions made for them can actually have them made through this algorithm. So really interesting. The focus is on getting the best outcome from that individual by personalizing these programs for them. So yeah, it's really interesting, and we're excited about the opportunity for the use of AI.
Awesome. Well, thank you all so much for joining us for this mental and behavioral health session today. Thank you, Salome and Chrissy, for all your wonderful questions and all of the wonderful conversation from our finalist companies. I would also like to make sure to invite everyone in our audience to our grand finale on October 21st at Health. Our Rising Stars will be announced at 1 p.m. on our awards pavilion stage at booth number 3254. And our grand finale for our best in class companies will be Monday night at 5 p.m. on the disco stage. And of course, everyone is invited to join us for our after party at 6 p.m. In Milo's in the Venetian. Thank you all so much for joining us. We will share out an edited recording of this session tomorrow. Thank you again and have a great rest of your day.